So, bipolar psychosis. Bipolar with psychotic features, psychotic breaks. Those words sound so extreme and serious, don't they? Well, in reality, they are about as serious as it gets, but not for many of the distorted reasons that most of the population believe due to mainstream media, Facebook memes, and trendy slang. So many people who hear the word psychosis or psychotic will automatically picture someone who's dangerous or going to go on some shooting rampage, running around in public naked and hallucinating, someone who's institutionalized in one of those white straitjackets, or most importantly, the assumption that people who are experiencing psychosis are like that all the time or that it can't be treated. Of course, when something horrible happens in the world that we don't understand, everyone likes to have a reason, so it just makes sense. It drives me crazy every time I see a shooting or some kind of extreme behavior, and the media's immediate go-to justification to the public is always mentioning that the person was, quote, mentally ill. This perpetuates incredible negative stigmas, and it's almost as irresponsible or irrelevant as saying something like, the person was diabetic and their blood sugar was low, so that's why they shot someone. Let's be very clear that the majority of violent crimes and homicides are committed by people who don't have mental health problems. Now, of course, people who are struggling with mental illness do occasionally get violent or commit crimes when they're experiencing psychosis or abusing substances, but that's a lot more rare than most people assume. This makes the 9th video in our ongoing series titled Faces of Bipolar Disorder. So far, we've discussed everything from diagnosis to the different types, major symptoms, and a lot more. If you're new to all of this and would like to get an incredible perspective on the illness, this series is a really good place to start. Today, we're going to talk about what bipolar psychosis is, certain signs to watch out for or symptoms, treatment, and a lot more. If this is your first time here, a very warm welcome to Polar Warriors, YouTube's #1 free source for bipolar education, tools, and growth. So what is bipolar psychosis? It's basically the end of the line for a lot of us, where we go far beyond a severe or manic or depressive episode where we literally lose ourselves in the illness. People experiencing psychosis often can't distinguish the difference between the external or objective real world and their own subjective perceptions, which are usually distorted by delusions and even sometimes hallucinations. Psychosis is most commonly associated with type 1 bipolar disorder, where symptoms of full-blown mania progress so much that it leads to bipolar psychosis. Psychosis can also occur during periods of severe depression and in people that have other types of bipolar, but that's much less common. As I've mentioned in so many videos, we all experience bipolar differently. So just because someone experiences psychosis doesn't mean that their diagnosis is inaccurate. Many people find out that they have bipolar after being hospitalized with psychosis. That was actually how my journey started. Some have family or friends that intervene out of serious concern, or some even end up finding out after being arrested or incarcerated. Studies have demonstrated that around 2/3 of people who have bipolar will experience at least one psychotic symptom throughout their lifetime. About 1/3 of patients will never experience psychosis. The more notable symptoms of psychosis include things like delusions, confusion or disassociation from reality, extremely disturbing or outlandish grandiose thoughts that feel so real, a complete lack of self-awareness or insight into our behaviors, severe paranoia, and sometimes even hallucinations. The symptoms of bipolar psychosis typically match the mood that someone's experiencing. For example, if someone's experiencing mania with psychosis, they might believe that they're invincible or have special powers or that they're on some mission from God to save the world. The combination of mania and psychosis can lead to extremely dangerous, reckless behavior. If psychosis occurs during a period of severe depression, people might believe that someone's trying to hurt them or that they've done something horribly wrong and should be punished. Or in extreme cases, they might hear voices telling them to harm themselves or to end their lives. When psychosis reflects the mood or beliefs that someone has, like I just mentioned, this is called mood congruent psychosis. If the subject of the delusions or hallucinations aren't related to the person's feelings at the time, it's called mood incongruent psychosis. So there's two primary types. Psychosis in general can exacerbate symptoms like extreme anger, paralyzing depression, or fear and paranoia. It's like bipolar symptoms on steroids. Doctors are still working on understanding exactly why delusions occur or how these complex mental events come about in the first place. I mentioned hallucinations as a component of some bipolar psychosis, and this is a little more rare. Hallucinations involve hearing, seeing, smelling, or even feeling something that's not actually there. Auditory and visual hallucinations are the most common with bipolar disorder psychosis. The symptoms are usually brief, grandiose, and usually related to some kind of delusional belief. One of the most common ones would be religious experiences, like seeing the face of God somewhere or believing that they hear Satan telling them to do something bad. It's important to know that not all psychosis is the same. There are other types of mental illness like schizophrenia, where the symptoms of psychosis can manifest or progress a lot differently. They might have similar features, and both can be extremely disruptive in our lives. Bipolar psychosis usually lasts for shorter periods of time, and then we typically return back to a euthemic or at least a lucid state of mind. For someone with schizophrenia, psychosis can last for months, years, or they might not even return to a lucid state, and they can remain delusional or disassociated with fixed beliefs indefinitely. Psychosis with schizophrenia tends to be much more of a negative experience for the patient. For example, they might believe that someone is out to get them or have extreme feelings of isolation and alienation. This is part of why so many people with schizophrenia are so often isolated. With bipolar disorder, psychosis usually has a more, quote, wish fulfillment component, where we might be more optimistic or have great grandiose expectations. Due to the isolating characteristics of schizophrenia, bipolar psychosis is more likely to incorporate extreme or inappropriate degrees of sharing, intimacy, or a sense of connection to others during the psychotic episode. Bipolar psychosis is what I call an equal opportunity symptom, meaning it affects people equally across all genders, races, and age groups. When it comes to age and the onset of symptoms, the Diagnostic and Statistical Manual, or the DSM-5, outlines the same criteria for symptoms in both adults and children. The average age that most bipolar symptoms typically start to manifest is during people's early to mid-20s. It's more rare for teens or children to be diagnosed with bipolar psychosis because of how difficult it is to pinpoint the causes of certain abnormal behavior. So many kids in the modern world are extremely overstimulated. They experience a lot of social stress, and they go through drastic biochemical changes during adolescence. They could have experienced some kind of acute trauma growing up, or could be starting to show signs of a different mental health problem that mimics some of the behaviors of bipolar psychosis. I know people can get very anxious to have answers, but it's extremely important not to rush or push for a diagnosis, especially if it's a child or a young adult. Let the doctors take their time asking questions and getting to know the scope of the situation. Getting misdiagnosed or put on the wrong treatment program can cause things to actually get much worse. If you're the parent of someone who starts displaying abnormal behavior and much more severe mood swings than are typical for that age group, it's always best to check with a doctor. Bipolar is a progressive illness that can get worse over time if it isn't treated. That's a really important one to remember. And that being said, don't waste any time if you think something's wrong. A lot of people wait simply out of the fear of what they might find out. This could be the worst thing that you could do if you're responsible for someone's care. Don't wait. Incidentally, a lot of teachers spend more time with some people's children than their own parents. Talking to a teacher could be a great way to get insight into behavior that you might not notice at home. If you're a teacher yourself, it could be extremely valuable to educate yourself on the basics of mental illnesses, because you could make a huge difference by being a conscientious observer. You could literally save a life by noticing symptoms of an illness at an early age. Another thing I want to touch on is how bipolar psychosis usually doesn't just happen out of the blue. It might seem like that and be very shocking to those who are experiencing or witnessing it for the first time. But as you get to know more about bipolar disorder, it'll get easier to notice the signs or symptoms before they progress into something like psychosis. This can be easier for those around us, like friends or loved ones, because part of the illness can include not being able to see that we're ill in the first place. Knowledge and information can be almost as effective of a preventative as some medications can be. Many of us will start out by experiencing typical mania, which progresses into hypomania or a mixed episode, and then it goes even further and becomes full-blown mania, and eventually that can lead to psychosis. If you can learn to notice the telltale distinct signs that show up in a specific individual or even yourself before becoming symptomatic, you can take action, like getting them to a doctor before they end up in jail or hospitalized. There are usually very specific things that people will say or do at the start of a bipolar episode. They might be subtle or sometimes very obvious. As you continue to watch videos like this and learn more about bipolar disorder, it'll become easier to know exactly what to look for and what to do. As far as treatment goes for bipolar psychosis, it really comes down to the type and severity of symptoms. Sometimes it might be as simple as adjusting or adding a new medication. Other times it might require something more serious, like hospitalization. The most effective treatment for bipolar psychosis is a comprehensive, holistic approach, meaning the combination of meds, therapy, lifestyle changes, self-help, and having a support team. Every little thing helps, and bipolar needs to be hit from multiple angles because it's a spectrum disorder, unlike unipolar depression. As far as meds go, the first time I was put on an antipsychotic med, the first thing I said to the doctor was, "I'm not psychotic, I just have bipolar. Why are you giving me this?" I didn't know that it was just a classification of drugs used to treat bipolar symptoms in general. In fact, many of the mood stabilizers we take were originally developed for other things like seizures, for example. So many people get put on an anticonvulsant med like Depakote or Lamictal, even if we don't have epilepsy. In rare cases, some patients are offered things like ECT or electroconvulsive therapy if meds or traditional therapy aren't providing relief. ECT is another treatment that is so misunderstood and the perfect topic for a future video. The last treatment I want to touch on is hospitalization. I've spoken to so many people who are scared to death of getting admitted to the hospital or an intake center during psychosis. Sure, it's not a fun way to spend the weekend, but it's nothing like the movies or stigmas portray. I've been hospitalized several times, and it saved my life, literally. They have the meds and the specialists available to get us the help that we need through the hardest times that we go through. When someone is hospitalized for a major episode like psychosis, it's common for doctors to use higher doses of heavier meds to be able to penetrate through the strongest of our symptoms. It's a temporary treatment to get us through times of crisis. The important thing I want to touch on with hospitalization is the aftermath. When you get out, there's going to be an adjustment period. Most people won't be able to just jump right back into work or family life. If you were medicated, those meds are going to be working themselves out of your system for a little while. Any major changes in our environment or routine can also be a big trigger, so it's really important to have a quiet, peaceful environment to recover in when you get out. Lastly, a really challenging part of psychosis is when you have to face what happened. If you just woke up in the hospital, don't understand what happened, and then a doctor throws a diagnosis like bipolar at you, it's going to take some time to process all of that. A new diagnosis can raise as many questions as it does answers, so please don't do this alone. Contact a therapist or get an emergency appointment if you can. Hospitalization is another crucial topic that we'll cover more thoroughly in future videos. I hope this video, like the others in this multi-part bipolar series, helped to get some well-needed information out there. If you're new to bipolar disorder, check out the other videos in this series. You're going to learn a lot about bipolar disorder if you watch them. As always, a very special thanks to my partner, the International Bipolar Foundation, for helping my videos reach a larger audience. And just a reminder, if you haven't checked out my growing community on Patreon yet, there's a lot of videos that aren't on my YouTube channel there. Take good care of yourselves this week and stop by Polar Warriors again soon for lots more helpful videos. Stay well.